Hello, I'm Kostasi Levins, and I'm going to be talking to you about the arteries, the veins, and two specialized exams that deals with the echocardiogram. Now, your artery transport oxygen-rich blood from the heart to the organs and tissues through the body. Okay, the ascending aorta originate from the left ventricle and form three main branches, starting with the brachiocephalic artery, which divides into the right subclavian artery and the right common carotid artery. Then the left common carotid artery arises and followed by the left subclavian artery. The subclavian artery originates at the inner border of the scalenus anterior muscle. It travels beneath the clavicle to the outer border of the first rib, where it becomes the axillary artery. The axillary artery terminates at the tendon teres major muscle, where it becomes the brachial artery. The brachial artery terminates just below the antecubital fossa into the radial and ulnar arteries. Then the descending aorta, which is here, you should see the descending aorta is the continuation of the aorta beyond the aortic arch, where it divides into the thoracic and abdominal section. The abdominal aorta bifurcates into the right and left common iliac artery, which is here. Each common iliac artery bifurcates into the internal iliac artery and the external iliac artery. The external iliac artery terminates at the inguinal ligament, which is in here, to become the common femoral artery, which is here. The common femoral artery travels distal to the groin and bifurcates into the femoral artery and the profunda artery, which is here, on the outer here, profunda artery. The femoral artery travels distal through the abductus canal and terminate at the adductor magnum muscle to become the popliteal artery. The popliteal artery travels behind the knee and terminate into the anterior tibial artery and the tibial peroneal trunk. The anterior tibial travels distal to become the dorsalis pedis artery. And then you should see the posterior tibial artery and the peroneal artery. Now let's talk about our veins that are in the body. The veins return the deoxygenated blood from the organs and tissues back to the heart. We start back at the top at the brachiocephalic vein that's formed by the subclavian artery, which is here in this area. And the brachiocephalic vein is formed by the subclavian and the internal jugular vein. It travels distal to the axillary vein, which is going to be in here, to the brachial veins to bifurcate to the radial and ulnar veins, which is going to be traveling here. Now, your lower extremities will have the starts in here with the inferior vena cava to the common iliac vein, and then that bifurcates into the internal iliac veins, and the external iliac vein goes into the deep femoral vein, into the profunda vein, This would be somewhere in the profunda vein. Goes all the way down to the popliteal vein, to the anterior tibia vein, which would be over here, to the posterior tibia trunk. And then you have the posterior tibia vein and the perineal vein that goes here. And remember, your veins are, and you have deep veins and superficial veins in your lower extremities. Your deep veins are gonna be your drainage route for your legs, and your deep veins for your arms are gonna transport deoxygenated blood from the superficial to the central venous system. And now we're gonna talk about the two exams. One is the TTE, which is the transthoracic echocardiogram. Is a common type of echocardiogram. It captures a still or moving image of the internal part of the heart using ultrasound. The probe is placed on the chest or the abdomen of the subject to give various views of the heart. It will show any problem in the heart or even blood vessels near the heart. The ideal position is to have the patient on their back or on their left side. And in this position, the technician will be able to move the transducer to different areas on your chest to get certain views. Then we have your TEE, which is your transesophageal echocardiogram. Usually done when the doctor wants to look more closely at your heart, meaning they want a very specific part of the heart to be imaged with greater resolution. Doctors may also use TEE to guide cardiac catheterization, help prepare for surgery, or assess a patient's status during or after surgery. The sound wave will show pictures of the heart muscle chambers and the valves. To perform a TEE, you will be sedated and your throat will be numbed, and a probe about the size of your index finger is put into your mouth and down your esophagus. During the procedure, you may feel the probe moving, but it will not be painful nor will it interfere with your breathing. And thank you.